I'm Dr. Steflik with Coastal Integrative Healthcare. I'm going to share with you some important information regarding disease. And this is disease in general, but we can apply it specifically with arthritis. So with any disease, there's a beginning and there's an end. What happens at the end of a disease? One of two things. Either you're cured or you die. The disease ends that way. Now, with most conditions, we could look at cancer and heart disease as other examples. There's a beginning, there's a first half and a second half. Where do the majority of the symptoms show up in these types of diseases, and actually any disease? Most people think it's the first half, but in reality, it's oftentimes the second half. This can be seen with cancer. How many of you have known someone who's had cancer, maybe a stage 4 cancer, had no symptoms until it was too late? Same thing could be said of heart disease. Someone could have heart disease for years and years, have no symptoms until the very first symptom, which could also be the last symptom of heart disease, could be a heart attack. And that could be the end of the disease. Arthritis is very much the same way. A patient may have had an injury or a trauma, maybe a car accident, 15, 20 years ago, possibly a sports injury, a knee injury from football or rugby or soccer, something like that. That injury may have healed and repaired itself to some extent years ago, but now, 15, 20 years later, that arthritis has continued on. Maybe they didn't feel any pain for those 15, 20 years. Then just 6 months ago, the patient states that they're feeling an increase in pain. They're feeling symptoms are getting worse. It hurts to walk. It hurts to do their daily activities. Well, did that disease start 6 months ago when the symptoms showed up? Or did it start 15, 20 years ago originally when there was that accident, that injury, or that trauma? So when we take an x-ray and we look at that knee and we see that it's almost bone on bone, we know that it didn't start 6 months ago. A good knee doesn't go to a bad knee in 6 months and lose almost all the cartilage. It's taken time to get to that point, but maybe there wasn't a symptom. Waiting until you have symptoms is a bad idea if you're waiting on a symptom to go see the doctor. In our clinic, we're very preventative. We want to help our patients before they have problems and help them as soon as they do have problems. If you wait too long, a patient may not be a good candidate for regenerative medicine and stem cell therapy. They may have to do a surgery. That may be their only option, would be a joint replacement. We don't like that. We want to be able to help our patients before they get to that point. So keep in mind the disease timeline. And just because you've had symptoms only for a few months doesn't mean that it's severe, doesn't mean that it hasn't been going on for a longer period of time. If you found this useful or helpful, please share and leave a comment, and we would love to connect. We'll talk to you soon. Thanks.